Hello guys, welcome to my YouTube channel Legend of Pharmacy. Today in this video we will discuss a very important condition. It is a deadly condition, we can say, that is heat stroke. That the heat stroke is common in summer season. Okay, we are going through the summer season. This heat stroke is very common, very common. Among 1000 people, for 20 members, this heat stroke can be attacked. So you have to understand this concept very well, so that you can save your life and also the life of a opponent. Here you will discuss about the causes, symptoms, diagnosis, treatment and the prevention. How can you prevent this sunstroke or heat stroke or heat excitation? Let's start. Before going to this, let's study some difference, or let's study some definition of that heat stroke, what actually this is. See, heat stroke is a condition caused by your body overheating, usually as a result of prolonged exposure to or physical exertion in high temperature. Simple, the heat stroke just is exposing our body to the heat. Okay, if our body get exposed to the heat, that condition is lead to the heat stroke. Not all exposure of the body leads to heat stroke, but some exposure, like working down in the summer season, or working for a long day, in the whole day working down to the summer, or down in the sun, working in a long day without using any hats, okay, or without using any shades for the protection of the skin, using working in a large hours, working in a huge hours in a day in the summer. This most serious form of heat injury, heat stroke, can occur if your body temperature rises to 104 degree or higher. If the body temperature is rises for 104 degree or higher, that is 40 degree Celsius, that condition leads to heat stroke. Okay, if actually our body temperature is 37 degree Celsius, 98.4 degree Fahrenheit, okay, that is our normal actual body temperature. If any fluctuations in these temperatures may lead to heat stroke. Either 38 also no problem, 38.5 also no problem. It raises to the 40 degree, more than 40 degree, then it's problem. It leads to the organ damage, rupture of the blood vessels. Okay, these all are the major conditions will caused by the heat stroke. Don't worry, we will discuss how to manage this heat stroke, and it can be easily manageable. Okay, if you are not treated, means then it leads to the deadly condition. Actually it is not a disease or not a virus, no, just a condition that occurs in the summer season, especially in the European countries, in the Asian countries. Okay, if where there is a huge amount of heat at that time. Now causes, exposure to the hot environment, simple causes. Okay, then wearing excess clothing like 2 to 3 jackets we are wearing inside the one bunion. On that bunion we are using, then we are wearing shirts, on that shirts we are using another type of the jackets. These all stuff, these all compact leads to the heat stroke. Drinking alcohol, this is also one condition that leads to the heat stroke. Then dehydration, keeping our body away from the water, not drinking appropriate amount of the water. What is the appropriate amount of water we have to drink? Minimum 2.5 liter. Okay, to maintain the very good condition of the body, means hydration, we have to drink 3 liter in a day. Okay, then exercising in hot place, wherever it may be, or you working for a large hours in the kitchen, working in large hours in a kitchen, that too leads to the, that is a major cause for the which one, heat stroke. Symptoms, see, high body temperature, it is one of the common symptom here in this heat stroke. High body temperature reaches more than 40 degree. Okay, altered mental state, means here confusion, dizziness, then means dizziness, vertigo, you are feeling like you don't know anything at all. These all type of the condition. Mental distress, skin becomes dry, no sweat. Okay, because of less amount of water in the body, Okay, there is no water inside the human body, so that it can evaporate through the skin and make your body cool. Actually, why sweat will comes? It will evaporate the water. It will remove the water from the body to maintain the condition of the body temperature. If the sweat will not comes, means you have to understand that your body temperature is not maintained and you are suffering from dehydration. Immediately consume the water. Consuming as much as water, okay, means more water will keep your body hydrated and keep you active whole day. Nausea, vomiting, it is also one symptom. Then racing heart rate, that is a sudden tachycardia condition. Heart rate is increased, headache is increased, rapid breathing and redness of the skin. Your skin becomes totally red without any pimples or without any bumps on your skin or without any small pimple like structures on, just a redness. That's because of the this. It is a major symptom of your heat stroke. Then treatment, simple treatment is there. Before going to the treatment, understand the diagnosis. Say rectal temperature. Rectal temperature, it is one of the actual measurement of the body temperature. Rectal temperature. Okay, else we can use the, if means it is unsuitable, because rectal temperature we cannot use by ourselves. Better, if rectal temperature is not possible, you go for the underarm pit temperature, or you can go for the forehead temperature measurement. Simple. Blood test, urine test, X-ray or CT scan is essential or necessary if any sort of the organ damage is there. Blood test is required to know the amount of blood. Okay, how much amount of blood is there any sort of dehydration has been happened, that all can be measured. Urine test means they will check the proper running of the kidneys, okay, proper functioning of the kidneys, they all do this. X-ray or CT, the main intention of this is to know the organ damage, if any sort of organ damage is there or not. Okay, yeah. Next, our treatment. What is the treatment? See, being hydrated is one of the major treatment. You should be hydrated. Drink lots of water in the summer season, and bring the person to the cool place. If you saw a person, he is suffering from the heat stroke, his all conditions, the symptoms, causes, what that all. Okay, so better, what I am telling you, to know the disease, you have to understand the symptoms are very important, causes are very important. By this understanding, means causes and symptoms, your 80% problem is solved. So bring that person to the cool place, or if AC is present, on that AC, apply ice cube on body or wet blanket. Take ice cubes if available, or just take water, apply on the body, especially in the armpits, near the cervical region, head region. You have to, head region means just a cervical region, the neck part, there you have to apply some pressure. So some pressure means cool pressure, cool blanket pressure, or cube pressure, that is ice cube pressure you have to apply. This will reduce the temperature. Okay, then drink ORSL juice, give some of the ORSL juice, oral rehydration salt, if the patient is not unconscious. If he is conscious, means just to try to keep him cool, call the ambulance. This is very basic step you have to do. Take a normal water bath, normal water bath, not excessive hot or not excessive cold. It's normal water bath you can take, it feels very better for you. Then benzodiazepines are given to stop shivering. If any sort of the seizures are there, means benzodiazepines are given by the doctors, are given by the physicians. So these are the treatment followed by the doctors in the hospital. And prevention, see, in the home what you have to do means try to drink a lot of water. Don't drink cold drinks. Cold drinks, they contain the carbohydrates, that is the sugary elements, which will increases your body temperature. Then don't drink coffee also. Okay, maintain the coffee level in the summer season. Not only coffee, tea, soft drinks, these all things you have to maintain. Then remove excess clothing. I have told you, if the person is suffering from a stroke, that is sunstroke or heat stroke, remove the clothing and just leave that man or woman in a banyan for a few condition, means for a few minutes, so that it can be the heat present inside the body, they can easily evaporate. Then be relaxed, don't be tensed, be relaxed. Okay, be relaxed. It is one of the major role in the heat stroke. Be relaxed, cool. After few minutes the body temperature decreases, then you can be in a safe zone. This is the deadly condition, you have to know. Yes, today in this video we have discussed the prevention, what is the actual diagnosis, actual treatment, symptoms of this, causes, and the heat stroke actually what it is. So if you like this video, subscribe Let's Jump Pharmacy, turn on the bell icon. Thank you.